Hey guys, I'm Dr. Norris Goldberg, owner and clinical director here at Koru Chiropractic in Louisville, Colorado. And today I want to talk to you about your spinal hygiene. Today's video is going to focus on range of motion, right? Range of motion is the direction that we should be able to move our spine, and it includes things like flexion, extension, rotation both ways, and lateral flexion both ways, right? So those are the 6 primary ranges of motion that we have in our spine, and we need to be able to perform these ranges of motion in the 3 areas of our spine, right? Our cervical spine, our thoracic spine, and our lumbar spine. Now, the problem that we have with our spine, and if you do say yoga regularly, you might not have this problem. You're moving through a lot of those ranges of motion through the different yoga practices, right? But the average person who's not practicing yoga, who's maybe even sitting at a desk, we're oftentimes just stuck in this position, right? Flexion. In fact, this is what I see most commonly in the practice. Kind of the one thing that just about everybody has as a problem in their spine is forward head posture, right? So I call it the 21st century problem because it's sitting right in front of you right now, your computer, your phone, technology, even just reading. If you're reading a book, but you do a lot of reading and you're sitting, you're looking down, that used to be old school bad posture. Now everybody has that bad posture. So the first place to start, we're gonna get into some stretching and activations and exercises, but the first place to start is just understanding how your spine is supposed to move, what those ranges of motion look like and what they feel like, okay? So we're gonna start in the cervical spine. Right, so as I mentioned, flexion and extension, that's simply just looking down, right? And you can just start by dropping the chin down. You can get really intricate and try to feel each individual segment in your spine move by just kind of slowly moving, retracting that chin, looking all the way down. Some people will even turn this into a full body flexion and stretch. That's totally fine. Out of all of the ranges of motion, flexion is the one that we do too much, as I just mentioned. And so I'm gonna want you to do a lot more of the other ranges of motion, things like rotation, right? So simply, if you've got especially a lot of neck pain, this can be something that you've been avoiding, right? You've been watching out because you know you might get zapped if you look too hard in one direction or you move too fast, right? And so nice and slow, in control. I want you to think about being long and tall in your spine, right? Really, if you've done yoga, they talk about mountain pose, right? So this feeling like you're stretching yourself from your feet, which are making contact with the ground, through the crown of your head, right? So elongating your spine, opening those joints up, and then simply just turning to the side, and then the other side. Sometimes you're gonna feel a little crunchy, cracky, crinkling sound. That's okay. A lot of times if you're doing this regularly, you're gonna hear less of that sound, which is a great sign that you're keeping your joints in better alignment and they're healthier, okay? So ultimately, I want you to go side to side, probably about 10 times each. And then we're gonna go lateral flexion. So we're gonna just drop that ear to the shoulder, side to side. Again, you might feel some different creakiness or crunchiness. A lot of times once you've done this several times, you won't notice it as much. I find that after people have been getting adjusted regularly, they don't notice it at all anymore. So it has something to do with maintaining the motion through the adjustment. And then the idea behind giving you this exercise is when we're doing corrective care adjustments to your body is that you can maintain in between adjustments. You can do some of the range of motion and keep the improvements that we're seeing immediately after an adjustment so that they actually come into the next adjustment and we can compound on top of those, okay? So the last one that I failed to mention in the beginning was extension. So I want you to do extension just by simply pointing the chin up towards the ceiling, going back as far as we can here. Good, you should feel a nice stretch through the front of the throat. Right, now most people have done these exercises or at least somewhat familiar with them, but if you've been struggling with a lot of pain, I want you to work your way through these. I don't want you to work into extreme painful ranges of motion, but working through a little bit of pain is not a bad thing necessarily. And then if you start getting really dizzy, you start getting a lot of neck pain, you start feeling woozy or numbness or tingling, anything weird happens, that's really where you should be consulting with a doctor. Our cervical spine is a very sensitive area. It's really the connection between our brain and our body. And so if you start getting symptoms by doing these very basic exercises, please consult with a professional, someone like myself. All right, so we're gonna talk a little bit about the thoracic spine. Now the thoracic spine, because we've got this big rib cage, we've got a lot of bone in this part of our body, right? It doesn't move as much, but what we can do is we can bend it side to side, right? We can do a little bit of lateral flexion just by sliding my hands up and down the seam of my pants. And what I can do by keeping my hips still and really kind of getting my shoulders out over my center of gravity is just really open up this space, right? And that's what I'm going for here. Some people will put a little neck stretch in there. I don't really like that one as much, but you can try it if you like. I also, a lot of times, will put my hands over my head and then do the side bending. Oh yeah, it feels good right there. Nice big opening. I feel a great stretch when I do it this way, really from the back of my arm, my lats, down through the rib cage here. So this is my preferred method, a little side to side. A lot of times I'll do this one in the sauna a couple times each way. And so the next one is gonna be rotation. Okay, so rotation, a lot of times I'll keep my hand up here. I just like the feeling how this opens my ribs up and allows for a little bit more range of motion. And so I'm keeping my feet planted. I'm feeling a little bit of twist and tension in my hips because I'm rotating, but really the main twist is really feeling it between the shoulder blades here. And I'm gonna show you another variation of this that you can do on the floor. It looks something like this. So with the thoracic rotation exercises, you can do this laying down as well and put the hands either behind the head or even just one hand at a time. And as you twist up, you're really gonna feel a big twist through the mid-back right under the shoulder blade. You could hold both hands and turn like that. Just gives you a little support. Or we can even do this kind of like a child's pose where I'll stay up on one elbow. I'll put the hand behind the shoulder, so almost like this, and then open up and close, open and close. So we've done lateral flexion, we've done rotation. Now in the thoracic spine, there is flexion extension. My preferred method, while you can do this standing, it's gonna look a little bit like cat-cow, okay? And so a lot of times I'll take my hands, I'll kind of put them almost on the top of my glutes, over the like SI joints where that dimple in my back is. And what I'm gonna do is I'm gonna push forward so that my low back is supported. It's not gonna get jammed up. So this is a really important one. If you're dealing with some really aggravated, jolty low back pain, a lot of people don't wanna go into extension necessarily because it can really set things off. And so we wanna do this slow and control. What I want you to do is really focus on squeezing your glutes, putting your hands on those glutes so everything feels nice and supported, and then slowly pushing the hips forward and tilting the head and neck back until I'm arched all the way back as far as I can go, okay? That's gonna accomplish extension both in the low back and the thoracic spine. You can also do it on all fours like a cat-cow, and it looks something like this. So you guys, this is the cat-cow, right? So this is where we wanna get some flexion extension in both the thoracic spine and the lumbar spine. So let me show you how. If I'm just on all fours here, feet can kind of just go flat to the ground, or you can put your toes up, but I think ideally keeping your toes flat to the ground is good. I'm just in a nice base of support here. I shouldn't feel any imbalance whatsoever. What we're gonna do is we're gonna breathe in and really kind of arching our back more. So I really feel that kind of right here. So arching, I'm pushing up with my hands and looking up slightly. And then as I breathe out, I'm gonna push my spine in the other direction. You can see it's really lifting up just a little bit, right there is where it's the highest point. So that's where I feel the most pressure. And we can kind of change this actually by rocking a little bit. So as I lean forward, when I lean back, I feel it kind of go up towards my neck. When I lean back, I feel that arc kind of move down a little bit, but really this is a good thoracic spine flexion extension exercise. You're not gonna feel it as much in your low back, but it's all connected. We gotta keep it all moving, okay? Those are some more advanced variations. Again, you could do this seated at first and then move to laying and then maybe move to a quadruped position if you wanna make it a little bit more advanced and athletic. So when it comes to lumbar, right, our lumbar spine is down here. When it comes to lumbar range of motion issues, we typically have the same problem we do in the neck. There's too much flexion, right? So I'm not gonna focus a lot on flexion. I'm gonna focus a lot more on extension and how do we get that extension, rotation, and lateral flexion in the lumbar spine. Now the joints are shaped differently. It's gonna feel a little different. And so I'm gonna show you how to do this. I actually prefer for this part sitting. There's a couple different methods. I'm gonna show you a few ground exercises or floor exercises you can do, but the first one is the simplest way, and that's gonna be seated, okay? So I'm sitting on this chair here. I'm gonna put one hand out to the side and one hand straight up. What I wanna do is just let that elbow bend, really reach and bend over. So I'm probably gonna get a little further to the side than I did before when I was just doing the thoracic side bending. You can see when I do it seated, a lot of that bend is happening right here in my thoracic spine, but I wanna target down here, right? So what I'm gonna do is I'm gonna bend the elbow, I'm gonna put the arm up, and I'm really gonna bend over as far as I can. My elbow is almost touching the ground right here. And by the way, I'm not leaning really far forward or really far back. I'm trying to go straight to the side, and I really feel it right here. That's where I wanna target that feeling of space opening up and also compressing on the other side. The next thing is rotation, right? So this one's easy, sitting nice and straight, again, almost like that mountain pose. Pulling your belly button in is gonna just open your spine up and give you more space. And then you can turn to the side, you can put a hand on the knee and reach behind your back. You don't wanna crank, there's no jolting in this, but if you feel a little pop, that's okay. It's just motion happening in your joints, okay? But what you wanna do is as you're twisting, think about pulling your spine up as you twist to create more space, and you might feel that all the way up into the shoulder blades essentially, but especially again down here. So that covers the lateral flexion, the rotation, and the last thing we need to talk about more is extension. So we already kind of covered one of these with the standing extension pose where I had my hands behind my back and I was really just leaning back. That's one great way to do it, but not everyone has the balance or the core strength that they can do that and really get back as far as I would want them to. So the next thing to do then is do it laying down, okay? So we're gonna try it right here. All right, so as we're laying down here, the first thing you can do is, if you got a cranky low back, let's ease you into this. Let's just start laying face down, stack your hands like this, just rest your chin right on your hands, okay? Chin can go on your hands or even your forehead on your hands. This is sort of step one. Step two is like, can we get into more extension? For some people, this is just the hardest place to get because they spend so much time slouched forward that their spine, their muscles, everything doesn't really want to come back anymore. And so just getting up on the elbows, doing like a supported cobra yoga pose is what this would be. And then eventually we can get even higher and we can push up right here. Now what the key is if I'm gonna go higher is I'm gonna really squeeze my glutes, okay? So I'm never gonna go into extension without first squeezing my glutes into the table. So that's the first thing, squeeze and then lift, okay? So I got some great extension there. Kind of just letting my head go with my shoulders. I don't need to look back really far, and I'm definitely not letting it just hang down lazily. It just goes with the shoulders. And then another way we can do it is not supported, but whether we just keep our arms to the side, you can put them up like this. We can put a diamond on the back, it doesn't really matter. But what we're gonna do is we're gonna squeeze those glutes, and because I'm not supporting with my arms, my legs kind of come up. You can see how my glutes squeeze, my legs come up, and then I'm gonna lift my chest off the ground. And we're gonna get some great extension in there. And for a lot of people, honestly, that's gonna be the hardest one. You're gonna start really feeling the weakness in your back that we need to address, and that's what the next videos are gonna be about. So the key is I want you to get into that range of motion. I want you to do more extension, but I don't want you to work through extreme pain while you're doing these exercises. I want you to do about 10 reps each. I want you to do them on a daily basis, if not a couple times a day. If you sit a lot, you should be breaking these exercises out at least 2 or 3 times a day. Even if it's just means sitting there and kind of doing a quick reset, couple twists and turns to each side, that can do wonders for your spine on a daily basis. So I'm Dr. Norris Goldberg. I'm the owner and clinical director here at Koru Chiropractic, and I'm hoping you're enjoying these spinal hygiene exercises. This is the 2.0 version. So if you want to see more videos about how to take care of your spine and have optimized neurological and spinal health, make sure you subscribe to our channel below and like, follow, comment for more.